So the stroke belt is not by itself. So it is the southeastern states which have a very high stroke death rate. It also happens to be the hypertension belt, the diabetes belt, the smoking belt, and possibly even periodontal disease belt. So all this translates to risk factors for stroke. So these risk factors are more prevalent in these regions, which leads to ischemic stroke, not only stroke, but stroke at a younger age. So it is identifying those risk factors, which are quite prevalent in this region, is probably the critical thing. Absolutely. So one of the things is a big deficiency within our system is the medical professional not necessarily paying attention to the oral health in every patient, and some simple tool for them to be screening. The primary care healthcare provider may be looking for gum disease in the form of bleeding, recession of gum, or a loose tooth or a lost tooth is important for the medical professional, and then communicating to the patients that it's important to do oral hygiene on a daily basis, and not only that, visit the dentist at least in a semi-annual fashion for regular maintenance kind of thing. So I think those are kind of important things I would point to the medical professional. Identifying that there are risk factors for stroke, and these are stroke and heart attack. Some of them are called as modifiable risk factors where we can do something about it. They include hypertension, diabetes, cholesterol, smoking. I would think that periodontal disease would be added to that list. There are others which are called the non-modifiable, which includes things like age, race, gender, which we cannot do something about. To focus on those modifiable risk factors so that we can prevent the stroke belt, the heart attack belt in the southeastern United States.
Well, the primary one is that it's now time for dentists to not only know about relationships between oral and systemic, but start doing something about it, and do it in a practical way, and do it in a way that actually does two things: acquires more patients and creates a sustainability of the patients that they have by developing relationships with those patients that you care about them. It is absolutely overlooked. We're consistently looking at how many crowns did we do, how many implants did we place, how many new patients did we get. I'm not from the old school. I think today's environment, they want to know if you care about them and that they have a home that they can go to. And that home is not just going through that medical history to make sure that I may do something that doesn't hurt you. What's more important is that I'm going through that medical history because I care about you. So not just asking questions about, do you have diabetes? No, asking questions of, do you have frequent thirst? Have you gained weight? Looking for those things that you might say, maybe you do need to see a physician. I mean, I want to manage you, but I'm managing all of you, not just your oral health. We know as a fact that there is more face time with a dental hygienist than any other healthcare provider that a patient will ever be with. The dentist runs the show, but it is his or her team that does a substantial amount of the delivery of what we do. So all of that behavioral change is coming from that team.